Hi, I'm Dr. Abhaya Kumar SM, consultant medical oncologist at Manipal Hospital Whitefield, Bangalore. So once we suspect presence of lymph nodes in the neck, groin or axilla, so our next step is we do the biopsy of the lymph node. Usually we excise complete whole node, send it to a lab. So in the lab, the pathologist will see the lymph nodes under the microscope. He will see the histopathology. So when under the microscope he suspects Hodgkin's lymphoma, then he will do the next step, that is the chemical stain we call as the immunohistochemistry. Hence the diagnosis of Hodgkin's lymphoma is by seeing under the microscope, that is histopathology along with the immunohistochemistry. These two are helpful for the diagnosis of Hodgkin's lymphoma. So once we do diagnosis, so next we do the staging. So normally we do the staging with the help of PET CT scan. So PET CT scan is most important for staging evaluation of Hodgkin's lymphoma. Usually we stage from stage 1 to stage 4. So the stage is more important because as the patient who presents with most earliest stage, that is stage 1, they have very highly curable, the cure rate is very high, like to 90% cure rate we can see. As the stage increases, the chances of cure rate will come down, the recurrence will increase. So after doing the imaging studies, we do patient blood evaluations and 2D echo. So these are helpful for the further therapy. So the therapy of Hodgkin's lymphoma is basically chemotherapy. It is a combination of chemotherapies. So these lymphomas, especially Hodgkin's lymphomas, they doesn't require any surgery. The treatment is purely chemotherapy. With combination of chemotherapy only, majority of the patients we can able to cure. And the chemotherapy regimen which we use for Hodgkin's lymphoma is better tolerable even in pediatric age group, also even in adolescents or young adults, even in elderly people also. Majority of them are able to tolerate the chemotherapy which we use for Hodgkin's lymphoma, and hence whenever Hodgkin's lymphoma is diagnosed, so you should always take therapy, because majority of them are able to tolerate the therapy and they also able to get cured by the therapies, and also with a lesser side effects with the therapy. So some of the patients we also add radiotherapy, especially when there is a residual disease or when the tumor size was very bulky. After completion of chemotherapy, so we add radiotherapy as a part of protocol. So and hence the treatment is either purely chemotherapy or the combination of chemo plus radiotherapies. Any one of the two modalities we use depending upon the patient risk, whether it is a favorable risk or unfavorable risk, or stage, whether early stage or advanced stage, like stage 1 or 2 or stage 3 or 4. So after the completion of the therapy, we do again PET CT scan and we document whether there is a complete response, there is no evidence of disease. Once there is no evidence of disease, these patients we keep under follow-up up to 5 years. We do initially every 3 to 6 months physical examination, then imaging based upon the requirement, either CT imaging or PET CT imaging.